6:50 is our time right now. Wolfville resident and MS patient Chris Alkenbrack has fired off a letter to the Prime Minister requesting a formal apology from Senator Kelvin Ogilvie, suggesting his comments show what Chris calls a profound lack of respect to MS patients across Canada. And Chris Alkenbrack joins us on the phone this afternoon. Hi, Chris.
A quick correction. The Kelvin Ogilvie is the chair of this committee. The comments were not made by Kelvin Ogilvie.
Oh, okay.
They were made by Senator Judith Seidman.
Who's a Tory senator.
That's correct.
And that's why you've written the Prime Minister.
That is correct.
What did he say?
I haven't got an answer back, of course. I've left messages. In fact, I left a message for Senator Ogilvie earlier this afternoon, hoping that I could speak with him, because he is the representative for the Annapolis Valley and was former rector at Acadia University here in Wolfville. So I was hoping, to get to speak to him before this interview, but that didn't take place.
Senator, is it Seidman, is it?
That's correct, Judith Seidman.
Yeah, and what did she say that, has got your goat here?
Well, first of all, she was presenting at the committee, the discussion committee for the Bill S-204, and it was her body language, it was her remarks, it was her bursts of sarcastic laughter when she was talking about this treatment, the CCSVI treatment. I'll read a quick quote that she said. She's talking about the study, and she said the improvements could be largely due to high expectations of patients for an intervention called liberation, at which time you see very clearly on the CPAC video, she turns her head with a wide smirk on her face, and then she goes, a significant name for the treatment, which she said very sarcastically.
Senator Seidman.
Thank you, Chair. Their conclusion was that the subjective positive effects reported by about 50% of the patients can be largely due to the high expectation of patients for an intervention called liberation. Significant name for a treatment.
A couple minutes later, one of the expert witnesses, Dr. Barry Rubin, was speaking, and when he said, he was explaining that liberation doesn't actually mean liberation from MS, it means liberation of the blood flow out of the brain, and Senator Seidman clearly and audibly offers a sarcastic chuckle when he makes that statement.
Dr. Rubin?
The intervention study, I should note that it was originally termed liberation by Dr. Zamboni, not because people are liberated from MS, but because the procedure liberates blood flow out of the brain.
And she's the one, she's being she's touting the party line. She's being, I don't know whether it's too much to say this on the air, but she's been the government pit bull in all of this.
So you think she's echoing the sentiments of the Harper government?
Absolutely. Yeah, they're trying to protect the fact that they haven't intervened as quickly as their promises. Every time they make a promise, something happens. Every time they say we're going to move on this, well, they take months and months and months before they actually move on. And one of the things I found offensive in Senator Seidman's presentation is she talks about, there was a new study, the Cosmos study they call it. It was done by and funded by Italian MS Society, and it was only an imaging study, and they're saying that, we can now turn the page on CCSVI. It's an end to it. We only found, in the largest study, a 3.26 prevalence of CCSVI in MS patients. Now, first of all, it was funded by the MS Society. They found a prevalence of 3.26%. It was done with imaging methodology only. We have another study that came out pretty much at the same time. It was independently studied by the Buffalo Neuroimaging Analysis Center, done by neurologist Robert Zvadinov. The methodology was intravascular ultrasound. They also used imaging, but they went into the veins and looked at them. Okay, so in this one, 3.26%. And in Robert Zvadinov's study, they find 86% abnormalities in the azygous vein, 84 in the left internal jugular, and 76 in the right internal jugular. So, I think we have to look at the source of funding.
Yeah, really. Well, and you have told us in the past that the MS Society hasn't been on board with this whole liberation thing.
No, I don't think so. Yeah, I think that they've done everything to downplay it. Another thing, if you don't mind me just mentioning too,
sure.
Rick, another thing that I found offensive at this committee is they're refusing any type of expert witnesses, or patient witnesses, despite the fact that several of the Liberal senators have requested patient witnesses.
Would it help our deliberations and give us a better insight if we had patients who have gone through this as witnesses at this committee?
And in fact, there are two expert witnesses in the last committee meeting when asked, well, do you think we should have, patient witnesses? Dr. Barry Rubin, who was one of the expert witnesses, he said to be transparent, you should absolutely hear from patients.
Well, really?
So I think that as this is a transparent process, that absolutely you should hear from patients that have MS, you should hear from patients who benefited from the procedure, and you should hear from patients who had the procedure and had no benefit or indeed had complications.
Sure. He also said, I think there is nothing like looking someone in the eye when you are talking to them. Bernie Yerlink, or Professor Bernard Yerlink, he's actually on a board member of the CCSVI society with me. He said too. He said human-to-human contact has a much greater impact than paper-to-human contact.
I think a human-to-human contact has a greater impact than a paper-to-human contact.
I think there's nothing like looking somebody in the eye when you're talking to them.
And yet, any expert witness, anybody who has actually done the procedure in Canada, has been refused to be an expert witness.
Well, you would think that the people who actually, who had the therapy and it's worked or it hasn't worked would be, great anecdotal evidence for this here.
I think so, and I think, you need a balance of those that it worked for, those who it didn't work for. Yeah. We're learning from the research that, it works for about 66% of the people, so 2/3. That's a pretty significant, pretty significant statistic when you look at improvements. And, like I said, when you have MS, any improvement in quality of life measurement.
Yeah, that's the thing. Any improvement. And you've noticed yourself a dramatic improvement.
Every time I come on, well, it's only been 2 years, 5 days, and 5 months. So anyway. So,
well, we'll wait with interest to see how if and when the Prime Minister responds. And
sure, I'll follow you up an email, any news that I get, Rick.
I underline that if.
All right.
I hope you're not holding your breath waiting for a reply.
Well, no, I'm not waiting for a reply. I don't live in some dreamland, But anyway, I think that people, I find this outrageous, some of the remarks that Senator Seidman made, and I think that if people want to protest, they need to contact Senator Kelvin Ogilvie. You just Google his name, Kelvin Ogilvie, Senator, and you'll come up and you'll have his email address. I think they should, people.
We're out of time now, Chris. Sorry, but it's a good idea to do. Thanks a lot for talking to us.
Thank you.
All right, bye-bye. Chris Alkenbrack, MS patient from the Valley.